Right now for you in Medical Rounds, September is Atrial Fibrillation or AFib Awareness Month. More than 2 million Americans are living right now with AFib, and many people want to know what it is, who is at risk, and really what can be done to help those people. Joining us right now to talk about it is Dr. Craig Moskowtiz, a cardiac electro-physiologist with the Hartford Healthcare Medical Group. Doctor, thank you very much for taking a few minutes to talk with us.
Thank you.
First, let me ask you, what exactly is AFib? How common is this?
So atrial fibrillation is an abnormal heart rhythm involving the top chambers of the heart. Instead of the normal pacemaker causing the heart to beat in a regular fashion, there's a more chaotic electrical activity which causes the heart to beat very irregularly and oftentimes much faster than it normally would. It's very common. Upwards of 12 million people in the United States are projected to have atrial fibrillation by 2030.
Oh, that's interesting. You just mentioned a few symptoms right there. Talk about those if you could. What are some of the things people can watch out for?
So interestingly, some patients may actually have no symptoms and the rhythm is discovered during a physical when their doctor may perform an EKG. But most oftentimes patients have symptoms: shortness of breath, decreased exercise tolerance, fatigue, palpitations, feeling their heart beating irregularly, lightheadedness, as well as chest pain are the common symptoms of atrial fibrillation.
Are there certain concerns if someone has it and it goes untreated or undiagnosed?
Yes, certainly. So stroke is one of the major risk factors associated with atrial fibrillation. So oftentimes the cornerstone of treatment is for a patient to be placed on a blood thinner depending on their individual risk factor for strokes. But they can also have heart failure as a result of atrial fibrillation, weakening of the heart muscle.
Well, it's obviously incredibly serious. What are some of the treatment options?
So medications can be used. We have medications that are called antiarrhythmic drugs. Sometimes the patients have to be hospitalized to be started on these medications. Ablation is a procedure that can be performed where doctors like myself go up through the groin with catheters and can actually use energy, either thermal energy or even something like cryo energy, to burn the areas where atrial fibrillation comes from in the heart to try to get rid of this rhythm, which is quite effective.
I was just going to say, is that what's called cryoablation? I hope I'm saying that correctly.
Yes, very good. So cryoablation is something that we offer at Hartford Hospital for our patients. We have an aggressive atrial fibrillation program where we're able to get our patients in quickly and evaluated in a comprehensive fashion. Cryoablation is a technology that we use to try to get the procedure done, sometimes in a more safe fashion, as well as shorter procedure times for patients, somewhere around an hour to an hour and 20 minutes for the whole procedure to be performed, whereas with other technologies it can take upwards of 3 to 4 hours.
Okay. It is incredible work you're doing, Doctor. Thank you very much, Dr. Craig Moskowtiz. We appreciate you taking a few minutes to talk with us this afternoon. Now, if anyone at home would like some more information, head to the website that you see right here on our screen, hartfordhealthcare.org/heart. For more information, we will post that as well on the Channel 3 app.